Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hello. I am so excited today because we're going to be talking about something that is really common and it happens a lot as an ENT PA. I see this all the time with not just seniors or young kids. It can be anybody, but it's the winter nosebleeds. We'll talk about why they come up. We'll talk about how to treat them. We'll talk about some things to prevent them. And so tonight or today, I'm going to share some of these tips. Now, I put out on my TikTok a good maybe 10-minute video talking about a way to treat nosebleeds at home. So I'll show part of that video on our program today. Now, I want to talk to you to share that there are some great ENT offices that I've worked at in throughout the state of Georgia and also in Virginia. I worked in ENT in California. As you know, I was recently there. Now, if you go to the ENT that I worked with in California, you would have to actually have Kaiser insurance. They see Kaiser patients or Kaiser members. So that ENT office, awesome office, and that is the Roseville Kaiser ENT. They also have a sister office in Sacramento. And so I want to give a great shout out to them. I work before I went to California in Virginia, and there's some really good ENT offices out there. I'm going to give a shout out to TPMG, which stands for Tidewater Multi-Specialty Medical Group, the TPMG. And that doctor out there was Dr. Martin, Pierre Martin. He's excellent. Now, really good for neck masses, those type surgeries. He does general ENT, things for larynx. He takes care of course, nosebleeds, but most of the time, the mid-levelers or the advanced practitioners will take care of those type things for him, unless it's a really out of control nosebleed and it's posterior and the person has to go to the OR. But excellent guy, TPMG. I want to give a shout out to them and their offices in Virginia. Now that's in Southern Virginia. So you have Suffolk, Norfolk. It's the Southampton area. Let's put it that way. The Southampton area. There's Also, I am here in Georgia right now. So I'm in Georgia, and a great ENT office that I used to be a part of with some excellent ENT docs was ENT Georgia South. ENT Georgia South. I want to give a shout out to them. They have a great group, and they're throughout the metro Atlanta area. In that metro Atlanta area, there's some great docs, and you may want to visit them. They have offices in Fayetteville. They have, I believe, they have an office in Buckhead. I know they have one in Stockbridge. That's where I used to work at, Fayetteville and Stockbridge. Great offices, great doctors, and their advanced practitioners are able to take care of you there. But look for any ENTs in the area that you are in. And I just wanted to shout out those particular offices. So let me just, without further ado, I want to jump into this episode, and then I'm going to talk to you a little bit more about my book that's going to be coming out, and that is Mastering the Doctor Visit. We'll talk about that after we get done at the end. So, what usually causes nosebleeds is when you have dry air. So if the humidity is low, which usually happens in the wintertime, because we turn our heaters on, heaters in the car, heaters in the home, heaters at work, small little heaters under your desk because it's too cold. And so we will pump up that heat. And when it's cold air outside, it dries out the mucosa. So anytime that the humidity is below 20%, that's going to cause dryness in the nose. It will cause the mucosal lining, which is supposed to be moist, to become dry. When it becomes dry, you'll see in that middle picture, you'll see a lot of blood vessels. And I'll show you something that will make that even more clear. Mucosal dehydration is what occurs. And then you can have something called epistaxis. 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 Epistax. Well, what's epistaxis? I'm glad you asked. That's nosebleeds. So, because I'm still paying my school loans, I want to make sure that I use those big words. And epistaxis is one of those. And it means just simply nosebleeds. So you increase the risk for that epistaxis because the nasal mucosa starts to crack, get dry, and the blood vessels or capillaries usually will rupture quickly. Now, the other causes outside of dry air, there's dry air. But if you have high blood pressure, so those of you that don't know, you have high blood pressure until the wintertime comes and your pressure goes up, that pumping very hard against those blood vessels that are in the nose, because the nose has a lot of vessels. Now, I want you to look at this bottom slide. The top slide says the high blood pressure, 183/95. That's high, not super high, but when it gets higher than that, and you have that dried mucosa, see that yellow arrow where it's pointed in that triangle? Right there is where there are some vessels. Now, because my audience, Body and Balance, are on top of it, you guys are sharp people, I give you a lot of things that you may think, wow, why am I needing to know this? Well, it's because I like people to have knowledge on things. Those vessels in the on the nasal septum are called Kesselbach vessels. Kesselbach vessels. So they run along the nose and it looks like a stream or a river of vessels that are there. And if they get dried out in that area, most nosebleeds, about 90% of your nosebleeds are from the anterior portion of your nose, the front part of your nose, which is why you bleed so harshly when it occurs. Now, there are nosebleeds that occur in the back of the nose, and those are usually urgent and something's going on really bad. And so you probably have to go to the ER for that. Blood thinners, those of you that have cardiac problems, and heart disease that would cause you to have to take aspirin, would cause you to have to take warfarin, Plavix, or any of those medications, they thin the blood. Well, if the blood's thin, it causes the blood to flow more. So you would have a greater, longer, stronger, heavier nosebleed than most people. Physical trauma, which is, if you look in the bottom picture and you see the little kid digging for gold in his nose, he looks like he's way up there too. Let me tell you what happens when the nose runs a lot and then it dries out. So the air dries out. Well, it dries and the nose starts to get crusting. And so when you have this crusting in the nose, what occurs is a lot of mucus, hardened, crusted mucus, which is, for lack of a better term, boogers. Kids, when they go to sleep at night, they can feel that crusting. So they start digging around in there. Now, it can happen in the daytime in the middle of school and they can start digging for gold. But when it's most common when you go in the room and you see, walk in your child's bedroom and you see it looks like an episode of Murder, She Wrote, because there's blood all over the pillows, blood all over the sheets. That's because their nose was bleeding during the night because of the digital trauma. Well, how do we rectify that? I'm glad you asked me. What a wonderful question. Well, you use a humidifier. Humidifiers maintain the moisture in the air and they will maintain about 40 to 60% of room humidity. That will prevent you from having nosebleeds. You don't have to go out and spend tons of money on a humidifier. I know Walmart has small humidifiers for about $15 to $17, and you can get a warm air humidifier or a cold air humidifier. I'll put that on the slide here that you can have either one. But remember from the last episode that I talked to you about in the winter allergies about dust mites, you tend to bring more or make the dust mites a little more hyperactive, and you also can develop more mold when you use the warm air in a closed environment that has a rug or something like that, carpet, that you are running your humidifier by. So you may want to consider just using a cool air humidifier. Warm air humidifier makes the room a little warm too. Now, I'm more fond of the warm air humidifiers, but just depends on how you like to sleep. Seasonal applications of those cooler air ones, you can use these humidifiers anywhere. You can get you a small desk one like the one you see in this picture, and you can put that at your desk if there is a lot of problems with dry air. Now, using emollients and nasal saline spray helps a lot. If you have recently had a nosebleed, you can use bacitracin. Bacitracin is an antibiotic ointment. Now, I want to caution you about doing that because some people use bacitracin and they tend to use it for too long. So if you use it more than 10 days, what you will do is kill most of the normal flora, normal body flora, bacteria that's in the nose. And if you do that, then what will happen is you'll start to get fungus, or you'll grow a fungus. You know that that's occurring when you're walking around and it smells like you've got a bag of Doritos opened up under your nose all day long. Now, Doritos are great. They're wonderful chips that people really like to eat. However, nobody wants to smell that all day long. It also could smell like sweaty gym socks. And so if you start smelling a sweaty gym sock smell, or a bag of Doritos in your nose, it stinks constantly, then you may need to consider, am I using too much bacitracin? I suggest you don't use it more than 10 days. If you've had a recent nosebleed, you can use it for that about 5 to 7 days, no more than 10, to keep it moist and to heal up the area where it was bleeding. You can do that for that amount of time. And then afterwards, I would switch over to, as it says there, Vaseline or the petroleum jelly. Using Vaseline or petroleum jelly will, only a small amount, don't put a big glob in there, just a small amount with a Q-tip, as it shows right there. I sometimes tell people to just go ahead and use the small finger and start from 12 o'clock and go all the way around. 12 o'clock and go all the way around. Okay, make sure you wash your hands afterwards. Now, the other thing you can use is AYR gel. That's a saline gel. AYR, it's a play on the word air. You can use AYR gel to apply in the nose just like you would the Vaseline. Or you can use the saline nasal spray. I suggest in the wintertime that you use the AYR gel, because you can put it in there at least 2 to 3 times a day, but it is thicker, so it has more consistency, and it stays in the nose and doesn't dry out as quickly as a saline spray would. So some lifestyle adjustments when you get nosebleeds. I'm kind of doing a little quick summary in the middle of my presentation today, or podcast today. Dry air and heating systems. If you have a humidifier on those systems, use it. If you don't, purchase you a portable one and put it in your room. Put it in your bedroom. Dry mucosa causes bleeding. Blood thinners can make you bleed easily, and picking the nose is a problem. High blood pressure. If your blood pressure is too high, that pounding of the blood against the vessels can make the vessels rupture. So things to talk about, things to stop the bleeding, is making sure you run a humidifier, use the AYR gel or the Vaseline, and we're going to talk about that Afrin, soaking an Afrin cotton ball. We'll talk about that, and I'm going to give a little video that I want you to see. So let's quickly move on. Some home management steps. We are at the point where I want you to watch this video. Watch this video with me. And with me showing this video, it is going to talk about how I teach my patients to stop a nosebleed. This video on how to stop a nosebleed. Nobody wants to go to the ER. So I'm going to give you a little trick. There's some stuff called Afrin, 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 or it's called oxymethylazone. Oxymethylazone. The generic name for it is oxymethylazone. You want to look for that because oxymethylazone is cheaper than the name brand aspirin, not aspirin, but Afrin, which makes sense. So you take a bottle of that when you start to get a nosebleed. And there are these cute little ice cubes that are disposable that you can buy. My son showed me those. I thought it was pretty cool. So right now, what I'm going to do is demonstrate what you do. This is what I, as an ENTPA, teach my patients to do and tell them to do when there's a nosebleed so that you don't have to go to the ER. Because a lot of times a nosebleed will last about 2 to 3 minutes and they'll stop. Sometimes it's just a few seconds or you'll get trace blood. That's not a bad nosebleed. A 5-minute nosebleed isn't bad. But when they get to be 45 minutes and you've got towels and pillowcases that you're using to try to stop and it won't stop, then I want you to try this trick. First of all, you take a cotton ball. I suggest you have those large cotton balls. The smaller cotton balls, you just pull them. But with the large cotton ball, you can roll those out. See how this is unfolding? You can just unfold that like so. And once you get it all the way folded out, then you want to take it and fold it in half, pull it a little bit, and then you fold it over. You take your Afrin and you just soak this thing really, really good. It sprays on. Now, this is a generic one, so it's not working as well, but you soak this. There you go. Really good. And once you get it really good and soaked, like this one is, let's see. This one's the no drip, so it's a little different. You want to get the one that sprays out. So once you do that, you roll it kind of like a little cigarette, or for some of you that like to do this or like to do that, fatty. You'll roll it up, and then you take this and just pull it, because you may not need all of it. Just pull it and you twist it into the nose, the side that's bleeding. Just twist it in there and it will fit. See how this is fitting? It will fit all the way in the nose, okay? You twist it in the nose, and then if you have one of those pinchers, you pinch it, or you put the little ice cube or a pack of peas, a frozen pack of peas, and you lay that on the nose. Do that for about 3 to 5 minutes, and that should stop your nosebleed and keep you out of the ER. Now, a lot of times if you go to the ER, by the time you sit there long enough, because they're going to take in heart attacks, car accidents, those that are coming in an ambulance, they're going to take them first for whatever's going on. Or gunshot wounds, if you're in that type of neighborhood where the ER is accepting a lot of those, they will get in before you. And by the time you get in 6 hours later, 5 or 6 hours later, your nosebleed's probably going to stop. And so I would suggest that you do this for 3 to 5 minutes at your house. Now, if it does not stop after that 3 to 5 minutes, then yes, you do need to go to the ER. So this is what I wanted to present to you as a teaching tool for nosebleeds or epistaxis on behalf of Body in Balance. For more information on this topic and more, follow me on my YouTube channel on Body in Balance 25 and subscribe. Okay, I said that were those about those ice cubes. Let me go back on those ice cubes. I said that they were disposable. No, they're reusable. They're reusable. Some cute little reusables. So, some things to do, like I said on the slide. Make sure you pinch and hold your nose. Don't tip your head backwards. Lean forward, because if you tip your head backwards, the blood's going to run back into your throat, and then you're going to get these big clots in your throat that you'll be coughing out that look like hunks of liver. So don't do that. You can choke on that kind of stuff. All right, let's move on. Now, see the picture at the upper right, that's what those Kesselbach vessels look like on the nasal septum. And below that is what an ENT uses. They go in, they use a little nasal speculum, and they open the nose a little wide, and they have a headlight that we put a headlight on that shines a light so we can use our hands, because you can't hold the light and try to do the opening and try to do uh, the silver nitrate. The yellow sticks with the gray looks like match, the match look on the tip of it. That is silver nitrate. And that is wet and then rubbed up against where that nasal septum is. Now, those things sting a lot. They burn a lot. So what I kind of like to do when I have somebody that's coming in and they actively have had an active nosebleed in the last 2 days or 3 days, or that same day in the morning, and I'm seeing them in the afternoon, or they just recently had a bleed, I will soak the cotton ball, the Afrin cotton ball, and put a little lidocaine on it, and put a little lidocaine gel, and put it in the nose for about 3 to 5 minutes. Go and see another patient, come back, take it out. Because why did I do all that? Because it only takes a couple of seconds to just rub that on the nose. But when you use silver nitrate on the mucosal lining, it does sting. It burns. So to stop it from burning so badly, I usually put a little lidocaine gel and soak it with Afrin to try to constrict the vessels to help me so that I don't have to use so much of the nasal of the silver nitrate. Now, I noticed that it looks like you could get that silver nitrate. Hopefully, they're not selling those just on. Do not get these and put that on there, because using those can be dangerous. If you don't know what you're doing and you do that too much, you can close off a lot of the vessels, and then you're not getting blood flow to the tissue in your nose, and you can get a nasal perforation, or a hole in your nose, in your septum. And you will have, when you breathe, it'll sound like you're whistling through your nose all the time. When you try to go to sleep, it'll sound like you're whistling through your nose because air's whistling through there. You will get a lot of crusting, because whenever you have any kind of mucosal drainage or mucus drainage or anything, it'll crust up and it'll get in that circle or that opening in your septum. So I would suggest you do not try to buy these on your own. If you keep having nosebleeds this bad that you have to be cauterized, you need to go into a medical office, ENT office, or the emergency room. Sometimes some urgent cares do it. It's not often that the urgent cares do it. They usually leave that to the specialist. Now, the other thing that happens, and most of the time seniors get these, they're called rapid rhinos. And these, if you look at the lady that's there that has that white thing in, those are long, they're long packings. And they're wet. We wet them with saline and put a little bit of antibiotic ointment on there, and those get shoved into the nose or pushed into the nose as far as you can see that is pushed into. It goes back that far. It is not a comfortable feeling at all, because that little plastic area that comes out, we put a syringe on the end and we pump that up with air. So you'll have pressure so that you get a compression against the vessels to stop or to tamponade the bleeding, to stop the bleeding. Okay. So there are 3 different things that the ENTs will use. We'll use the silver nitrate sticks, which is the chemical cauterization. There is a electrical cauterization with where we use a what's called a bipolar, and that's just a little bit of electric cautery. And then we have the rapid rhinos, and there's different packings that you put in the nose. The packing has to stay. It has to stay at least 3 days to 5 days, which is why we put an antibiotic on there. You cannot leave that in past that 5 days. You need to get in within 3 to 5 days so that we can take that out, so that you don't get infection. Most times you leave the office and you do have an antibiotic that you have to take with that. So the role of the ENT is for the severe nosebleeds. I was trying to keep you out of the ER. If you have a small one, a mild or a moderate one where you can pack your nose with the Afrin soaked cotton and try to stop the bleeding, usually that works. Even for your kids, if you can do that and use the ice pack, put a little pressure against there with pinching, that would seem to stop it without having to do the drastic things that we just did in the slide previous. Okay. So in conclusion, the dry air is a big problem, and that's what causes a lot of nosebleeds in the wintertime. Understanding this is important because that way you know you need to use emollients, you need to use the saline nasal spray and put that in. If you use the antibiotic ointment, don't use it more than 10 days. And we want to use humidifiers. Cool air humidifiers are less, let's say, less hazardous as far as allergies because of mold and the excitement for the dust mites. If you have carpet and rug in a room or something like that. Gentle nasal care as far as your being hydrated, making sure you're hydrated in the wintertime. The other thing is, if you have a nosebleed for that first 2 weeks, if you're treated for a nosebleed or something, you can't be doing a lot of exercise, heavy lifting, pulling and bending, that type of thing, running, jumping. Those type things will increase the blood circulation to your head. And if you increase the blood circulation to your head, that can cause the nosebleed to occur again. Watching, if you are on blood thinners, you are not to stop your blood thinner. You have to talk to your cardiologist. Not even ENTs tell you to stop taking your blood thinner. Yes, it does make your blood thin and it can cause you to have nosebleeds, but you have to work in conjunction with your ENT doctor and your cardiologist to make sure that there is some help for that. Now that we are close to the end, I told you we were going to talk about my book, which I brought up a couple of weeks ago, and it is called Mastering the Doctor Visit. Mastering the Doctor Visit. What it does is it helps you as a patient to understand how to have a more symbiotic relationship with your provider. The things that we need to know, we need to understand in order to give better care to you. You need to know some things to do. And in the book, it tells you some things to be prepared and to get prepared for your doctor's appointment. There's always, you may feel like you're rushed, and there is a tight window for your office visit. They're usually like 20 minutes, 15 to 20 minute visits. And so when you come in, know what you need, know how long the visit, the problem or concern that you've had, know how long it's been going on, and talk to your doctor about that so that they can give you the appropriate care. So this book is going to be on Amazon. I will also have it on my TikTok shop, and the book, I didn't flash it for you all, but it will come up on my TikTok, and you'll see some things on my YouTube. I'm going to be putting out a commercial in the next couple of weeks for the book. Hopefully, you have gleaned some things, and I'm excited every time I get an opportunity to make you have more knowledge, because I love to tell you the things that your doctor doesn't have time to talk to you about in the office. Hopefully, your horizons have been enlightening.